You're a world expert in artificial intelligence, so many accolades, working really hard. And then there's a personal story that develops in your life that further shines a light on how you think about artificial intelligence and how we can use it. Do you mind sharing your personal story, that connection?
Yeah, so regarding my personal story, so in 2014, I got sick and I was diagnosed with breast cancer. It was the first time I was really sick in my life, and I didn't know much about the healthcare system before and how people and doctors make the decisions. I realized that there is like really so much potential AI can do to change healthcare for all of us. And it really makes sense to bring this very powerful machinery to help people who suffer. It's our obligation as scientists to bring our science to the point that it can reduce human suffering.
That's incredible. So, talk about how you looked at AI and how that helped improve your health. What actually happened?
So, one thing that I discovered when I was going through the treatment is how much manual labor is involved. If you want to take outcomes of the patients that happen, in the last 10 years and ask what happened to patients like me who took treatment A or treatment B, you need to have a human who would go to the charts and extract relevant information. It's just truly unbelievable that in this country, with these great achievements, when people, went to the moon, it's still done manually. Can you believe it? It
Wow.
is done manually. So the bigger point is that what AI can do, if you can take all this information, automate extraction of relevant bits and predict the trajectories, you can really be much more precise and personalized. And what we learn, across multiple areas of clinical science, that people based on their biology, based on their individual health, respond very differently to treatment, and you want to be able to personalize the care to them. And that's what AI can do. Another application relates to predicting how disease changes. And today, even we collect a lot of information about patients, this information, depends on human for interpretation. If you're looking at the mammogram on any image, there is like a clear sign of like a spot. You can say, yeah, this is cancer. That's what we can see. But maybe there are many other subtle things that are there in the image. Or if you have sequential images, maybe there is some changes that human eye just cannot perceive because these images are so big and they are so detailed that humans cannot really do it, no matter how great as a radiologist they are. On the other hand, machine can take millions of images with an outcomes and understand what is the likelihood that, let's say, this patient, which now we cannot see cancer in their body, but what is the likelihood that within few years they are going to develop cancer? So this kind of questions human radiologists, doctors cannot even ask, but we demonstrated that with machine learning you actually can do it.
So this is remarkable. It sounds like there are two massive fronts artificial intelligence can impact our healthcare. One is treatment, mass analyzing copious amounts of data, processing it and saying, okay, now we can get more personalized and say this might work better for person A, this might work better for person B, because of our capacity to crunch all that data and look at outcomes. But the second piece you're talking about is on the diagnostic front. It sounds like, again, the high-powered capacity of artificial intelligence and the capacity to crunch so much data that we're just limited as humans can actually lead to early diagnoses. And in the case of cancer, that is critical for long-term outcomes. Is that correct?
You're very, very correct that today, even though, the cure capacity increases every year, we still have a big, big number of diseases, like pancreatic cancer is just one example, where we really don't have any cure at this moment. What we do want to have is the capacity to look ahead. Now, what does it exactly mean, look ahead? We know that, for instance, cancer and neurodegenerative diseases, they don't develop at the moment that you diagnose. It's not like you diagnose today and it happened in the last month. Body undergoes a sequence of transformation for quite a long time. And what we did with the mammograms, which are X-rays of breast, we took the images of women for which we know the outcome. And now I know that these images, even though originally didn't show any cancer, within 5 years, this patient developed cancer. This patient didn't develop cancer. Can you train the machine to identify these very subtle things that happen there? And the answer is actually yes. We've done it, and it works very well across different populations, and it gives you a lot of opportunities because, first of all, maybe the patient can have some changes in the whole lifestyle. There are also chemo prevention. You can get some, medical treatment like drugs that can help you. You can also screen them with a higher frequency. So there are lots of things you can do preventatively if you know what's to come.